Prevention of brain stroke, cerebral vascular accident. In this disease, the blood supply of the brain via cerebral arteries is decreased due to obstruction produced by the clot or the thrombus formation within the lumina of the vessel, or the leakage of the blood from the weakened walls of the vessels. So it is of two types, ischemic and the hemorrhagic one. 80% cases, they are the related to the ischemic stroke. In ischemic stroke, the main cause is atherosclerosis. Atheroma formation, bad cholesterol is collected within the walls of the cerebral arteries. Whereas the main cause of the leaky vessels or the bleeding hemorrhage through the walls of the vessels within the brain is due to high blood pressure and the aneurysm, that is malformation in the structure of the cerebral arteries, that is aneurysm formation. So these are two basic factors responsible for the abnormality in the cerebral arteries, which leads to the deficient supply of oxygen and nutrition towards the various parts of the brain, or the, in other words, tissues of the brain or the centers of the brains performing or who has been allotted different functions in the human body. So the human brain is a very complicated, very intricate, very vital organ in the human body, which has been gifted by Almighty God to the human being. The higher centers of thinking, higher centers controlling all the vital functions, they are, controlled by the brain of the, especially the cerebrum of the human brain. So, the prevention of this disease, we have to prevent the formation of the clot in the lumina of the vessel. For that, we have to reduce the quantity of the blood, quantity of bad cholesterol in the blood, which is the main factor for the production of atheroma in the walls of the cerebral arteries. Similarly, we have to reduce the chances of hemorrhage from the cerebral arteries, which is mainly caused by the high blood pressure. Also, we have to maintain the normal blood pressure. So these are the main basic primary factors responsible for these two types of the cerebral vascular attack or the brain stroke or brain attack. Just like we can say heart attack, similar is the condition, that is the brain attack. You have to maintain your normal or healthy weight, to avoid the obesity, to control or reduce the intake of the saturated fat, to lower down the value or the quantity of bad cholesterol in the blood, take sufficient amount of water, have regular aerobic exercise for at least 30 minutes, first exercise. You may pick up some game, or you may pick up some hobbies which can be responsible for light exercise to maintain the flow of the blood. Next is sufficient quantity of fresh veggies and fruit. You have to maintain the anxiety, depression. These psychological factors, they also are the main risk factors for the production of brain attack. Quit smoking. Smoking is very injurious. Tobacco smoke that consists of thousands of the injurious chemicals which damage the tissues of the brain centers. Also it produces, the damage the walls of that chemical present in the smoke damage the inner lining endothelium of the cerebral arteries. Also in the other organs, the same damage is produced by this chemical, especially in the heart and the kidney. So quit smoking. Next is maintain the blood pressure in the normal limits. If you are suffering from high blood pressure, take regular dose of antihypertensive medicines. If you are diabetic, take regular medication of the antidiabetic medicine. So these are the basic main factors for the prevention or to avoid the exaggeration of the symptoms in the brain attack or brain stroke, or to avoid these symptoms or the pathology in the normal persons. So you have to maintain normal blood pressure, you have to maintain healthy diet, healthy weight, you have to maintain the brain health, that is psychologically you must be free of anxieties, tensions, depressions and other similar psychogenic factors. They are also the main risk factors. So these are the basic factors. Take sufficient amount of water, sufficient quantity of veggies, fresh veggies and the fruits. So these factors, they prevent the occurrence of the cerebral stroke or the cerebral vascular accident or the brain attack. The immediate action when you observe the symptoms of the brain stroke, that is, there is drooping of face, weakness of the arms and the legs, then there is slurring in the speech. Don't waste the time. Immediate go to the hospital so that there is injection of the TPA injection, plasminogen, tissue plasminogen activator, enzyme activator, that is given IV infusion, or that can be directly infused through the catheter and towards the location of the clot. We have to dissolve that clot. We have to disperse that clot so that the pathway of the blood supply is open, and that we have to save the death of the brain tissues. So these are the basic factors which are essential for the health of the brain tissues and to avoid the brain attack.